Hi, I'm Dr. Priya Matthew at MVP Family Dental, and today I'd like to talk to you a little bit about dentures because we get some questions about them, so hopefully you'll have a better understanding after this. Dentures are made of acrylic basically, and they have artificial teeth on them, so they're used to replace your teeth when you are missing teeth. So if somebody was missing a good amount of teeth, at least 3 or more I would say, then they would want to look at a denture to replace those teeth. Yes, there are different types of dentures. One is a complete denture, which means you're fully edentulous, no teeth on one arch. We call this one arch, your upper and your lower arch. So say somebody had no teeth on their upper arch, we would make a complete denture for their upper. Same thing on the lower, you can do a complete denture on the lower if somebody's missing all of their teeth. There's also a partial denture, which means somebody has some of their teeth, but they're missing some of their teeth in between. So we can make a denture to go around the teeth, hold on to the teeth that they still have, and fill in the spaces that are missing. Yeah, so there's different types of dentures. There's removable dentures. Those are the ones I just explained, like the full mouth, the complete dentures, and the partial dentures that are removable. There's also fixed partial dentures, which are cemented in, basically what you would call a bridge. A bridge is when you prepare two teeth like crowns, and you make a bridge that would cement the two with a tooth in between. So say you had two teeth and one was missing, you make a bridge or a fixed partial denture, same thing, to replace that missing tooth. So there are many different materials that dentures are made of. Complete dentures are usually made of acrylic. The teeth are acrylic and the base is acrylic. Same with the partial dentures, but partial dentures have metal sometimes. If they're they can be made out of cast metal, which is the part that's going to hold on to your teeth. But there's also flexible dentures, which is made out of a different material that doesn't have the metal, looks nicer. It's just a different material. And the fixed partial dentures, which are bridges, those are made out of zirconia or porcelain fused to metal, similar to the crowns. Yeah, so if a patient comes in, maybe they need new dentures. For instance, I had a patient recently who had a very worn down upper denture. The teeth were super worn down because they were 20 plus years old. So she also didn't have a lower partial. She had a few teeth remaining in the front. So we wanted to make her a lower partial and an upper full denture, so that way, they fit well together. Her upper would look more natural and less worn down. So she came in, we discussed what she was looking for. We took the impressions of her mouth, basically molds, and then we send that to the lab. The lab comes back with something to help us determine where her bite should be. They're called wax rims, and we basically have these little wax rims in the mouth on the top and the bottom to figure out where the bite should be. You don't want them to be too open or too closed. And then also taking into account the teeth that she still has in her mouth. And then the next step would be we send it back to the lab, and then it comes back with the teeth in it. So we have selected the color of the teeth and what we want, the color of the teeth. The lab helps us select the shape and the size depending on the patient, and basically we do the tooth try-in so the patient has what will be the final dentures, but in wax. So if we needed to change something with the bite or the occlusion, or we had to change the type of teeth or the color, we could still do that. If there is a need for another try-in, we do that if we're not satisfied with that first one. And then once we are good with that second try-in or the first try-in, we go on to finish. So we send it back to the lab, and the lab finishes it, takes out the wax, puts in acrylic exactly where the wax was, the teeth are exactly where they were in the try-in, and then we deliver them. So the patient goes home with them, tries them in, makes sure that she can take them out and in, and then if she has any issues, like needs any adjustments, she just gives us a call and we follow up with her. It can be difficult at first to speak with dentures, especially if you have never had them before, but if you're used to dentures and you're getting a new set, it usually isn't too hard to get used to it. It just takes a little bit of time, maybe a week or two, so that your brain can kind of rewire and know that there's new things in your mouth, and then once you get over that, you're good. The dentures will affect your ability to eat and drink regularly, in the sense that if you had your natural teeth and now you're transitioning to a denture, let's say because of gum disease or a lot of cavities everywhere that are not restorable, like we can't fix them, then it will be a transition to go to dentures. But if you have been edentulous without teeth for a long time, it's an adjustment. You do have to make an adjustment to learn how to chew with them. It's not the same as your natural teeth, so that's why we really, really try to keep patients' natural teeth as long as possible by doing, hygiene appointments and whatever we need to keep those teeth in the mouth. If that's not an option, it takes time to get used to the dentures, but once you get used to them, they're definitely better than no teeth. Yes, there is special care to take care of the mouth and gums after getting dentures. You do still want to come back to the dentist at least once a year. If you have no teeth and full dentures, you still want to be checked once a year for oral cancer or any kind of adjustments that might be needed on the denture, if there's anything rubbing anywhere, just to check the tissues and the gums and everything. And then, of course, if you have teeth still and you're wearing partial dentures, you want to come back for your regular hygiene appointments to keep those teeth where they're at. Dentures can last anywhere from 5 to 10 years or more. I've seen patients with 20-year-old dentures, but usually they've been wearing down by then. So I would say at least 5 to 10 years, if properly taken care of. It will take some time. It depends on the case. So if you are having extractions, like you're removing teeth and then getting the dentures placed immediately, it will take a few weeks to let the gums heal underneath, because there's immediate dentures where you put them right in after the extraction so that the patient doesn't have to go without teeth. Otherwise, if you're just getting the dentures placed and you've already had your extractions done a while back and they're healed from that, usually it's, you might get a little sore spot here and there, which you would call and we would adjust, and then a few days later you should be good. The cost of dentures can vary from, depending on what type of denture you're getting. There's many types. So you would come in for a consult and then we could go over how much the dentures would cost for you. Insurance does usually cover some portion of the dentures, and we would be happy to check that when you come in with your insurance information. Just schedule an appointment for a consult or a cleaning if that's applicable, and we can tell you if dentures is a good option for you.